Hi, this is Ryan Petrini, and this is my final project for Personal Marketing 2605. The first requirement for this course was to create two binders. Instead of creating two physical binders, I created two folders on my computer. This is because I use technology in my everyday life, and I'd be able to have all the information with me everywhere I go and be able to add and build onto this. My first folder is based on research. Within this folder, I have 8 research tabs, all for different pieces of research. I have the wellness development, I have vertebral subluxation, subluxation-based care, new vitalistic system, functional neurology, the mechanics, just chiropractic and spinal, bad medicine. So within the wellness development, I have a wellness treatment plan. In vertebral subluxation, I have 2 papers based on atlas and migraines and the realignment of the atlas. In the subluxation-based care, I have a cocaine addiction subluxation-based care paper. It explains how subluxations can help, the correction of subluxations can help a cocaine addict. New vitalistic systems and the philosophy of chiropractic. Functional neurology and chiropractic, how neurological adjustments are important. For the current mechanic system, it's techniques of chiropractic and the maintenance of your body. Chiropractic spinal, this one's about post-surgical neck syndrome and how chiropractic has helped with that. The first binder holds all this research, and all this research helps us to keep up to date with what's going on in our field and helps us better approach our understanding and spreading chiropractic, always having the newest information available to us. The second binder is an SOP binder. This has 8 tabs as well. The 8 tabs are, there's case history, healthcare class, physical exam, the pre-visit, progressive exam form, the report of findings, visit 1, x-ray protocols. So each of these is things that we would do in our practice during different visits while when the patients come in. And this binder gives us a baseline of starting our practice and how to build. Each tab helps us keep organized and make sure we have all the information needed for the patient, for us, and for our practice to run smoothly. Introduction to the office. You start with an exam. As you can see here under the component 1, you're going to use palpation and x-rays to find hypermobility, misalignments, hypomobility throughout the spine, the cervical, thoracic, lumbars, and even the pelvis area. You're looking for a head tilt, head rotation of the cervical spine, shoulder tilt, shoulder rotations. You're looking for the ranges of motion, flexion, extension, lateral flexion, and you're looking at the thoracolumbar spine as well, with flexion, extension, rotation, and lateral flexion. Next, you're going to do a neurological case history, and then an orthopedic case history. As you can see under the orthopedic, you're going to do a supine, which is face up, and a prone, which is face down. Techniques to check different ranges of muscle movement. Neurological, you're going to focus more on the brain. You're going to do a physical exam as well of all parts of the body, limbs, including the spine as well. You're then going to do part of component 2 is the pathophysiology, which is a bunch of tests. And then component 3 is myopathology, which focuses more on the muscles in the region, looking for muscle spasms. Component 4 is histopathology,
looking for joint compression. You look at an X-ray examination for hyaline cartilage erosion, lipping and spurring, disc degeneration, joint degeneration, muscle spasms, etc., edema. Component 5 is the pathophysiology or pathology. You're looking at local areas in the spine. You're seeing for wellness, total body wellness. You're initiate initial intensive care, reconstructive care. You're trying to decide what you're going to put the patient through, which is the working conclusions, what you detect needs to be done. You're going to put the chiropractic spinal adjustments, what you do. The case history is what the patient fills out, and then you'll run through it with them. They're going to do like the standard, their name and all that stuff. They're going to do about their health, loss of wellness, birth age, when things started, symptoms of now, previous things, previous surgeries, are they experiencing lack of sleep, back pain, fevers, diarrhea, other things. They're going to have their insurance information on there as well. You're going to ask if there was heart disease or arthritis or cancer or diabetes or any other diseases that could potentially be passed on in your family from mother or father's side. Then you go into the report of findings. The report of findings goes through a physical case history, the physical examinations. You take all these findings and then you put them together to make your care plan. These are different possible examples of report of findings, such as muscle spasms, or here's some x-rays, serious, severe, or extreme histopathology. In the pathophysiology, it shows a graph of the damaged nerve and a healthy nerve, and those are the types of things you're looking at. And over here, you're looking at subluxation degeneration in the cervical spine, normal phase 1, 2, 3, 4, 5, and near normal, and you will compare your patient's x-rays to those as well. Then there's the progressive report. In this report, if your health goal was and still is to relieve only the assuming initial direct care is complete, you'll close the case file. If your health goal is reconstructive care, then you are recommended course of care for the next 12 weeks or so, depending on what you do for your patients. And in those rare cases where progressive has been slower than expected, you'd outline using your professional opinion on how to move forward and how long it might take to get your patient better. And here are just different things. At the very end, see, here's a calendar where you'd mark when you'd want to see your patients back and for how long. For the next year, 6 months, 2 months, depending on how you feel your patients how often you feel your patients need to come back.
Hi Ignacio, I'm Dr. Petrini. What brought you into my office today?
Well, I was skimming the pool and I slipped and I fell, and now I have really bad low back pain.
Alright. Does anything make this pain better or worse?
When I'm on my fetal day, it's much worse, but laying down and putting some heat on it, that does make it better.
Okay. And on a scale of 1 to 10, what is the worst?
About an 8.5.
Alright, and what's the best?
My best day is usually like a 3.
And your average? Roughly?
Average, it's about like a 4 or 5.
Okay. So next we're going to go through a complex family history. And on here I want you to be as truthful and as detailed as possible, because although it might seem not important to you, it might give some importance to long-term care.
Okay.
possibilities. Okay. And then after that, we take some X-rays, and this is a requirement in my office because I want to give my patients the best care possible and give them the best adjustment possible as well. All right. All right, Ignacio. So determining from your evaluation earlier, I would like to see you twice a week for the next 2 months, and on your last visit, we will reevaluate you. This reevaluation will determine if we can move from condition-based care to a corrective care. And the reason we're reevaluating you is to see if you have any improvements or if we need to go at this problem from a different aspect, okay?
Okay.
If you have improvement, then we will move forward into a corrective, from a corrective-based care to a wellness and health-based care. And from there, when you graduate from there, we will move to a wellness-based care, and this is to keep your body in a complete optimal working order. And while under corrective condition-based care, I require all my new patients to go to an information session, which is our healthcare class, once a month. And this gives you information on chiropractic and what we will be doing in our meetings. Okay?
Okay.
During my first visit with Ignacio, we went over his case history, his family history, and what his chief complaint was. From there, we went through 5 specific components. We went and looked at his spinal kinesiology, which would be lateral flexion, different rotations and extensions in his spine. We looked at his neurological pathophysiology. Then we looked at myopathophysiology. Myopathophysiology is looking at muscles and the rotations with different muscle testing. Then we went into histopathophysiology using an X-ray examination. And then we looked at pathophysiology as well, which to see his whole body health. From there, we determined a care plan, which we set 2 days a week for 2 months. And then on the last day, we'd reevaluate him by doing the same tests we did on day 1. On day 1, we ran through those 5 components, and if he gets better, then we would move from his condition-based care to corrective care. Then corrective care, we would then move to a health and wellness care, and eventually to just a wellness-based care, trying to keep his body at its optimal working form. All right, today is the day we reevaluate you. Are you excited?
Oh, yes. Yes, I am.
Good. All right. So we're gonna just run through the test that we ran through the first day and see if you've gotten better or worse. And if you've gotten better, then we will move on to the next set of care. If not, then we will do another reevaluation and see what might be underlying those issues. Okay?
Okay, I just want to thank you because now I start to dance with no pain. You're the greatest doctor ever.
Oh, you're welcome. Okay. So at the end of this, I would really like you to take home this survey, and this survey will have a couple questions about the office, the management, the staff, myself as your doctor, and I'd like you to answer them as honestly as possible to see if we need to make any changes in the office. And on the back, we will also ask for referrals. If you could add 1 to 2 or 3 people, we'd like to really just get them in the office to check out the office and potentially have them come to a healthcare class, and they can check it out and learn about chiropractic and see if that's something that they might be interested in.
I will bring my family. And just a question.
Yes.
If I have trouble reading English, do you have it in Spanish?
I do, yes. We have a translator as well. We can have them come into the office if you need some help with that as well.
Thank you very much. I
You're
appreciate you, sir. I'll see you soon.
Thanks.